Welcome, Healthgist gals. This is part 2 of the webinar series on the topic, Why Am I Always Wet Down There? We will focus specifically on the sexually transmitted infections that give us feminine woes. So if you're a sexually active woman at any stage of life or plan on becoming sexually active, then please join us to get some information that can help you keep healthy and can actually help save your life. In this webinar, we'll discuss the different types of sexually transmitted infections that can cause vaginal symptoms and how to recognize them early so that you can get speedy treatment and even what steps to take to prevent the infection in the first place. With nearly 30 years of combined clinical practice experience, we are board-certified family physicians who work predominantly with women. We have seen it all when it comes to sexually transmitted infections and have devised a simple program to review the most common types. Let's meet the following ladies whose stories will help demonstrate some of the main causes of vaginal discharge and infections. Meet Clarissa. She's a middle-aged divorcee who recently became intimate with her new boyfriend. Relatively soon, she starts to notice a lot of vaginal discharge and irritation, but her partner had no previous or current symptoms. Being a smart woman, Clarissa sought the help of her physician. This is what her doctor saw when she looked down there. Clarissa's cervix obviously looks irritated and inflamed, and there's discharge coming from it. Clarissa's diagnosis was an infection called chlamydia. This is the most commonly reported sexually transmitted infection in the United States. It is often a co-infection with gonorrhea, so it's common practice to treat both infections with antibiotics. Everyone involved with Clarissa sexually has to also be treated. Now let's meet Trisha. She's a young college student who had been experiencing thin, itchy, bubbly, almost snot-like colored discharge coming from her vagina. The irritation was really starting to bother her, so after a few days she went for a check. So this is what Trisha's doctor sees on her cervical exam. Trisha's diagnosis is trichomonas. This is another infection where all sexual contacts need to be treated along with Trisha with antibiotics. Now here's a very important Healthgist clinical pearl of information. Many cases of STIs have no symptoms. In other words, they're silent cases. And this happens a lot in men. So it's very difficult to pinpoint the time of inoculation. In other words, at which point in time and from which partner you got the infection from. So let's review the causes of wetness down there. The non-sexually transmitted reasons are yeast, bacterial vaginosis, and simple normal physiologic discharge. The sexually transmitted infections are chlamydia, gonorrhea, trichomonas. So let's move on and meet Hannah. She's a 30-year-old gal who had been feeling achy, almost like she had the flu. And then several days later, she had a lot of burning and painful sores show up on her vaginal labia, the outer lips and inner lips of her vagina. Some of the sores were actually turning into blisters and some were even crusting over. Hannah freaked out when she looked down between her legs with the mirror and saw what you see up on your screen. She immediately went to see her doctor, and it seemed like her physician diagnosed her with just one look. Hannah was told that she had herpes simplex infection or genital herpes. She was given an antiviral medication to take, and she learned that blood tests are usually not helpful and that these sores can reoccur. Now let's meet Helen. She's just at her doctor's office for a regular pap exam, and other than being a smoker, she had no other health issues, or so she thought. The doctor notices that at the beginning of her pap exam, Helen has a lot of dry, scaly bumps along her vaginal lips. Hannah has HPV, human papilloma viral infection. There are many strains of HPV, and some cause cervical cancer. And in Hannah's case, since she smokes, her risks are even higher. There are medications that can help her with her warts and sores, but there is no known cure. So it's even more important that she maintains a healthy immune system, and this might help suppress the virus and keep it in dormancy. In recent years, a preventable vaccination has become available, and this can be given to both girls and boys, men and women, and it's actually very powerful since it is one of only 2 vaccines that can prevent cancer. Here's Healthgist Pearl number 2. Though we have listed out the infections here one by one, just for simplicity's sake, remember that some patients can actually have several infections at one time, or even have them back to back to back. It is very common in my practice to see one woman with multiple symptoms and a discharge that's hard to describe or characterize, and it turns out that she has HPV, bacterial vaginosis, and chlamydia all at the same time. Finally, other STIs that are important but are not typically associated with causing vaginal moisture or discharge or sores are only briefly listed here: hepatitis B and C, HIV, syphilis, CMV. Now, wasn't that interesting? We hope you learned a lot about the most common ailments that can affect women in our most important parts. Do you want to learn more? Do you have any other health questions? You can spend hours sifting through online Google searches and be frustrated or scared witless, or you can enroll into Healthgist University. HealthgistU is just like having a doctor to consult in your back pocket or in your purse. You can ask us doctors a health question every month. And inside HealthgistU, as an enrollee, you will find in-depth, relevant information on women's health, and also tools like premium health articles, audios to listen to on lectures like the webinars, videos that teach you about certain important health topics, worksheets to help guide you through a better, healthy life, and little cheat sheets to help diagnose and treat yourself. Are you interested? Then log on to healthgistuniversity.com and enroll. This part of the webinar, we will accept your submitted questions and discuss them.